Alright, Alex, you're going to have a total of 10 minutes to complete the exam. You're going to be dispatched EMS 10, respond to a private residence for weakness. Caller was difficult to understand. Your time right now is 12:05.
Perfect. Alright, so I got my BSI.
Okay.
I'm going to make sure that I'm safe, that my partner's safe, and that my patient is safe.
Okay, you guys are safe?
As I approach the scene, I'm going to check for any environmental hazards. Do I see any?
You have none?
Okay, and I have just the one patient?
Yes.
Alright. Based off the call for weakness, I'm going to go with nature of illness.
Okay.
Yeah, I'm going to request additional resources given that it's a weakness call, so we're going to activate ALS.
Okay.
And I don't believe there's going to be any need for extrication or SMR, so we don't need to bring any of that stuff.
Okay, ALS is 15 minutes away.
Perfect. Alright, so as I approach my patient, I'm going to do a general impression. I see a male sitting in a chair, kind of leaning over. Anything else that I see?
Okay, no, your patient is sitting in a chair, leaning to the left side.
Okay, do I see anything life-threatening?
No life threats.
Okay, as I approach, I'm going to... Hello, sir, my name is Alex. Did you call 911 today?
Yes, Alex.
Yeah? Okay, what'd you call 911 for?
I have a very hard time controlling the left side of my body right now.
Okay, what's your name, sir?
My name is Rolando.
Rolando? What year is it, Rolando?
2019.
Perfect, and where are we right now?
We're at my home, Alex.
Okay. So based off of that, I can tell my patient's airway is patent. He's ANO times 3.
Okay.
Complaining of left side of weakness. How's my patient's breathing?
It's irregular, with normal tidal volume, but he is sitting at a 90.
Okay, 90 is pretty low for O2 saturation. We're going to go ahead and hook him up some non-rebreather, 10 liters per minute.
Okay.
I'm going to check the circulation. So how's the cap refill?
Underneath 2.
Okay. Do I see any obvious bleeding?
No bleeding.
Okay, and I'm going to check the pulse. How's the pulse?
Pulse is is very rapid.
Very rapid? Okay. And skin signs?
He's pale, warm, and moist.
Okay, so showing signs of poor perfusion with the low O2 saturation.
Okay.
We already got him on an auto-breather 10 liters per minute.
Okay.
I saw that you had some facial droop and some slurred speech. Do I see any other disabilities?
Besides the facial droop and slurred speech, no.
Okay, so at this point, I'm seeing some signs of stroke. We're going to test for fast. So, sir, can you go ahead? I already see the facial droop. Can you go ahead and stick your arms out for me?
Okay.
Get your arms. Close your eyes. Keep your hands up this way and try to keep your arms up for me as long as you can.
Okay.
Alright, definitely. Go ahead and put your arms down. I'm going to note some arm drift in the left. You can open your eyes. And then can you repeat the sentence for me? The sky is always blue in Southern California.
The sky is always blue in Southern California.
Okay. Alright. And then how long were the last time that you felt normal, that you felt?
I would
No
say
weakness.
maybe 30 minutes ago.
Okay, so time has been about 30 minutes of the symptoms. Alright. So we're definitely showing signs of stroke. I'm going to go ahead and expose the arm and the whole left side to see if there's anything else going on causing some numbness or weakness. Do I
Okay.
see anything?
No traumatic.
Okay. So my field impression is that I have, how old are you, sir?
39 years old.
A 39-year-old male complaining of left-sided weakness, times 30 minutes. Patient has poor breathing, poor circulation, so we got him on an auto-breather 10 liters per minute. We did activate ALS. How far are they now?
ALS is now 8 minutes away.
8 minutes out. How far is the nearest stroke center?
20 minutes away.
Okay, so we're definitely going to wait for ALS. This is a high priority patient, and we're going to transfer them to the stroke center as soon as ALS gets here.
Okay.
I'm going to go ahead and start my secondary.
Okay.
So sir, these symptoms that you've been having, this weakness, how long, did it come on pretty suddenly or gradually?
Extremely suddenly, Alex.
Really suddenly? Okay, and it's just the left side that hurts? Is it just the arm or the leg?
Just the left side.
Okay, is there anything that makes it better or worse?
I feel worse when I try to move because it's just a numbness feeling.
Okay, okay. And is there any other way to describe it other than numbness, or is it just that?
I have slight tingling throughout my left side, but
Okay.
mostly numbness.
Okay. On a severity of 1 to 10, a scale of 1 to 10, 10 being the worst, how would you rate it?
I've never felt this before, so I would say a 10.
Okay. All right. And you said it started about 30 minutes ago?
About 30 minutes ago.
Okay, perfect. Do you have any allergies?
No allergies.
No. And you said you're 39 years old?
Yes.
Okay. Do you have any medical history?
I have hypertension that I was diagnosed with a couple months ago.
Okay. Do you take medication for your hypertension?
I sadly ran out, so I haven't been able to take it.
Okay. And what's the name
I
of the
believe
medication?
the name is lisinopril.
Okay, perfect. And when's the last time you ate anything?
I would say about 6 hours ago.
6 hours ago. Okay. And what were you doing when the weakness started?
I was making dinner, and a delicious dinner, and I just felt extremely weak on the left side, and then that was all I remember.
Okay. So I'm going to go ahead and we're going to get a set of baseline vital signs right now.
Okay.
So what is my patient's blood pressure?
198 over 110.
Okay. And the eyes?
They are pearl.
All right. My patient's A1 times 3, but a little slow to respond,
Okay.
probably due to the stroke. What are the lung sounds?
Clear bilaterally.
And skin signs?
He's still normal, warm, and moist.
Okay. And the respiratory rate?
His respiratory rate is 24 irregular,
Okay. And the pulse?
94 and bounding.
Okay. So blood pressure's pretty high, but the rest of the vital signs look within normal limits.
Okay.
We are going to reassess every 5 minutes because
Okay.
the patient is showing signs of a stroke.
Okay.
We're going to wait for ALS, and as soon as you get here, we're going to transport it to the MAR. And I would like to get a second set of vital signs while we're waiting, since they were.
Okay. What do you need from me?
What's my second set for blood pressure?
202 over 112.
Okay, so getting a little bit higher. Eyes
Pearl.
and level of consciousness.
He's ANO times 3 still.
Okay, lung sounds,
Clear bilaterally.
skin signs.
He's normal, warm, and moist still.
Okay, so, respiratory rate.
20 and irregular as well.
Okay, and the pulse.
102 and bounding.
Okay, so just getting a little, vital signs are elevating a little bit, so we're going to continue reassessing every 5 minutes. We'll wait for ALS to get here so we can transport to the stroke center.
Okay. All done?
I'm finished.
Great job, Alex.
Thank you.